Welcome to Inside Social Care, the podcast that takes you behind the scenes of the care industry. Join us as we explore the challenges, celebrate the triumphs, and shine a spotlight on the incredible people who make up the social care workforce. From personal stories to policy deep dives, we're here to give you an unfiltered look at the heart of our communities. This is Inside Social Care, and this is where we start the conversation. Well, my guest today is the CEO of Care England and one of the loudest voices within adult social care for driving change and advocacy for the sector. Welcome to the podcast, Professor Martin Green.
Thank you very much. I'm delighted to be here.
Martin, do you ever get confused with the rapper Professor Green?
I do. Well, in fact, I have met the rapper Professor Green, who is absolutely charming. And I said to him, every time I make an appearance, everybody's disappointed that I'm not you.
Right, great. Where did you meet the real Professor Green?
I happened to meet him at an event in central London, and somebody introduced us.
Very good, very good. Okay, well, Martin, we're going to talk today about some of the agenda for driving change within adult social care. So I'll start with an open question. What's going on in social care today?
Well, there is so much going on in social care. And I think one of the challenges is to be really clear about what the most important things are and how we focus our attention on the things that will probably have the biggest impact. Now, in my view, we have seen some significant challenges around, for example, the national insurance contributions increase, and that has put a huge strain on care providers. But actually, much more damaging coming down the line are things like the Employment Rights Bill, and also the idea that there will be some kind of care wage, which will be higher than the living wage. Now, whilst we want to see much better remuneration for our staff in social care, and we would support the development of improved terms and conditions, the one thing that seems to be absent in any of the discussion is whether or not the government is going to put money in to pay for this. And I think that is our biggest challenge. Who is going to pay for this? Because what we've seen is with the national insurance contribution rises, the government has not paid for that. We are now at about £2.6 billion behind what we should be if we use the cost of care exercise. So there is a huge gap in the social care funding pot at the moment, and yet the government is considering heaping much more cost into the sector, but they have not been clear about how that is going to be paid for.
Lots of points on wrapping that. On the, I guess, first one, on the question of, because the sector has been asking and lobbying for more money, for more funding for quite some time now, and it seems to be a perennially repeating question. What are the issues that's stopping that being heard, do you think?
Well, I think one of our biggest problems is every politician is obsessed with the NHS. And what we saw when the government came to power, they gave an increase in the NHS budget, which was more than the entirety of the social care budget.
Because how much is the social care budget?
It's about 28 billion. And the government gave 30 billion to the NHS. And of course, what they do is governments, and it's successive governments, it's not just this one, but governments talk endlessly about integration. But what they don't do is recognize that if you have an integrated system, you have social care as important as the NHS. And these are two foundation stones of delivering good quality health and social care. There's also an issue for me about the fact that there is nobody receiving social care who's not getting it for any other reason. They have a health condition. So why is it that suddenly, arbitrarily, you're told these conditions we will give you free and these conditions you'll have to pay for? So I think there is some real, should we say, review and conversations that need to be had about whether or not our current system is fit for purpose in the 21st century. I think what we've got is a system that's based in 1948 and it's never moved from that.
It's interesting when you talk about, I mean, we'll go into this a lot more, the interface between the NHS and social care. And back when I was a doctor and, working in clinical medicine, you would see it break, the 2 points that things would break down was one, A&E, and two, discharge, right? So, A&E would be littered with, and with a huge amount of kind of like bilateral resentment there as well. So classic storyline in A&E would be sort of admissions from the community where, people who are charged with looking after someone maybe like a nursing home, for example, were admitting them to hospital. The people in the hospital would say this is an appropriate admission or whatever it is. And then similarly at the exit door, when you're trying to get people discharged into the community, just a total breakdown in communications there. I was talking to a very nice lady who worked, I can't remember the trust, but she worked in the sort of in the discharge team. And she was telling me the story of, she had a 5-strong team of people whose job was to get patients or residents out of hospital and back into an appropriate package of care in the community. And she said that 90% of her job was essentially managing the politics of dealing with NHS versus local authority funding, getting someone into the community, who's going to pay for this, and essentially everyone is playing a game of trying to run down the clock to try and shift the responsibility of where that pot of money is coming from. Now, notwithstanding the human tragedy of the person that's stuck in the middle of that, which must be extraordinarily traumatic, it does strike me that the inefficiencies that exist within that team of 5 people spending all of their time trying to find how you fund this person in the community, that's just a waste of money. And I wonder whether, I don't know where you sit on this, but is one of the fundamental challenges around the disconnect between the NHS and social care, is it based on having pots of money coming from 2 places? Health is from NHS, health is from the NHS, social care is from local authorities, and never the 2 budgets shall mix.
Well, of course, that is the problem. But of course, the other challenge is, what the hell have the ICBs been doing? We have been told that the ICBs were going to be about integration. And what they've done is they focused on the integration between primary care and the hospital. And this is what always happens. And Charles, I'm so old, I can remember coterminosity, joint appointments. I can remember PCTs. I can remember CCGs. We had health and wellbeing boards. They were all going to hold out integration as their outcome. We've also had significant amounts of money in things like the Better Care Fund, which was supposed to be smoothing out these transitions. The point you made as well about, for example, inappropriate admissions to A&E, well, GPs are getting a lot of money called the Enhanced Healthcare in Care Homes programme, and lots of them are doing absolutely nothing. And the only way in which people can be supported is to go through an emergency admission. And of course, the other challenge is lots of care homes could easily support people to live well if they had proper support from the NHS. But unless you are somebody who's living in the community, if you go into a care service or have a care package, then the NHS just abandons you. It's as if you don't exist to them. They think everything has to be done in social care. And when you look at the disproportionate allocations of money, it is completely ridiculous for us to have blocks in the system based on, well, who's going to pay? Because we've got mechanisms that should be dealing with that. Of course, there is another issue. We should have a regulator who, as an integrated regulator, regulating commissioning, regulating provision, regulating hospitals, GPs, community services and residential and home care, they should be the people who are saying, why isn't this working? Absolutely identifying where the blocks in the system are. The other thing the NHS is very good at is transferring blame. So what we saw this winter was a whole load of NHS leaders in acute hospitals going on television saying, we can't discharge because there's a problem in social care. Well, actually, there was no problem in social care, and the data was on my desk from Capacity Tracker. What there was an absolute inability for the NHS to use money, or for the Better Care Fund to be used, or indeed for local authorities to work collaboratively with their acute providers to get people out of hospital. We had the provision there, but they were just not using it properly. But the outrageous thing was they were not only not using it, but they were blaming us for their own self-made problems.
So again, lots to unpack in that as well. But you talk about the history of PCTs, CCGs, ICBs, all of these bodies that are set up to try and improve that integration between 2 parts of the system. Why do they keep failing? What's the root cause of that, in your opinion?
Well, in my opinion, it's all about the culture. So what everybody does, they change the structure, but they recycle people. And the same people who've come from the same culture, who don't understand how to be creative and innovative, are literally shuffled from one job to another. And we'll see exactly the same thing with the move from NHS England to the Department of Health. The people who failed us will land up in these jobs, and they'll just be in the Department of Health rather than in NHS England. So I think the issue for me is, if the government had spent, I think, 100th of the money they've spent on reorganization and restructuring, on culture change, we'd be in a much better position than we are today.
And okay, so how would you look to improve that? Okay, spend some money on culture change. I guess one of the points I'm trying to get, so again, if I look at a difference between the NHS and social care, and having kind of worked within both industries and kind of seen a few layers down in those, one of the things that I think is, and this is a slightly controversial point to make, but one of the things I often find about social care organizations is that they have, ultimately something to do with the fact that they're privately provided, have a very clear command and control structure, very clear org charts, very clear abilities to enact change relatively, compared to an NHS organization with, whether it's due to the size or the funding nature or whatever, have very, very unclear lines of decision making within those places. And you can speak to the CFO of one hospital trust and they say, well, this is great, but I've got to solve this at an ICB level and we don't meet for another 6 months, and there's a CFO here and I've got to speak to NHS England, and there's just so many cooks in the kitchen that there isn't really that kind of clear accountability and direction and control. And I guess no problem with social care, I guess, is your narrative. All the problem is with the NHS. What needs to change there then? Does that need wholesale reform?
No, I think it does. But you know what else I'm really sick of? I'm sick of the public sector thinking that it should be given a easy ride just because it's the public sector. My view is that, if you were in a business where there was no clear accountability lines and you weren't fit for purpose in the 21st century, what would happen is you'd go bankrupt. You wouldn't be given more money from the government because of your failure. People would expect you to deliver. And if, for example, you have Byzantine structures that don't allow proper decision making with accountability and outcome measures, then what you would do is you change those structures. But nobody does that in the NHS. What they do, they're in a perpetual cycle of whinging about not having enough money, telling us all how bloody hard they work, and then demanding more money from the government. And of course, the government gives them more money. And then, of course, what happens is they wait a few months and then they begin the whole cycle again. And yet social care is literally at the periphery of that. Now, if you look to the global budget of both health and social care, and you shifted the dial and stopped talking about organizations and processes, both in terms of social care and the NHS, and you started talking about people and outcomes, and you flowed the money towards the outcomes, what you'd do is you'd get better outcomes for people and you'd get enormous amounts of savings to the system. I'm quite controversial. I've given speeches where I've said, I think if we had a proper approach to outcomes and focusing on individuals rather than processes and organizations, I think we could have a Rolls-Royce health and social care service and remit money back to the Treasury. And the problem that we've got is we are so focused on an organization, the NHS, and we are so obsessed with it, it's become a national religion, that nobody is thinking, well, is it fit for purpose in the 21st century? Is it delivering what we need it to deliver? And if it isn't, let's go back to basics and let's restructure it, because that's what you'd do if you had to justify yourself to get your funding. And also the other issue, and we're going to see it with this reorganization of the NHS into the Department of Health and Social Care. And we saw it with the Care Quality Commission. Public sector bodies think that if they have to do a bit of reorganisation, we should give them 5 years whilst they navel gaze, and then we have to put up with not having business as usual. Well, I always tell them, let me tell you a story. It's called Twitter. What happened to them was they got the world's most difficult person by them. He told them he was rebranding. He told them that they had a 40% staffing cut. But did X go down? No, it didn't, because all that reorganisation had to go alongside business as usual. The public sector seems to think that it's got carte blanche to just put everything on hold, which is about their primary purpose, whilst they sit and wonder as to whether or not there'll be an X office, Y office, or who's going to be made redundant, usually to be re-employed a few months later.
Do you know any countries that do this well, or systems?
Well, I think there are systems that do things better than we do, and that's quite clear from evidence. But I also am I think we could look at international comparators, but I think what we need to do is start from where we are now and where we are here. And we need to,
Mm.
first of all, say, right, what do we want from a health and social care system? What do we want in terms of the expectations of citizens? How are we going to manage that in relation to budgets? How are we going to push budgets across different systems to get the best outcomes and the most efficient use of the resources? And so rather than fixating on whether or not they do it better in Japan or France, let's just say, get our own house in order by first of all
Mm.
creating our vision for what we want and then working backwards to say what do we need in order to deliver it and how are we
Mm.
going to measure the outcomes and the effectiveness of it.
And I totally agree. I guess going back to your sort of branding point, there are two challenges here, right? The NHS brand is, as you say, a national religion and so strong that any kind of reform is met with, huge potential public backlash without people really understand, giving it time, giving it the space or the time to conversely in social care, if you talk to a member of Joe Public about social care and talk about social care reform, they definitely won't mention the things that people in the sector know are most important, access to care, workforce, funding, all these issues. It will all be framed in the context of whether they need to sell their house to pay for care. And so I guess that's the other political issue that social care has, is that the public just doesn't really understand what social care reform means.
No, I think you're absolutely right. And partly, though, that conversation about whether or not you need to sell your house is very confusing for people because people are thinking, well, why do I need to sell my house? Well, it's because I've got Alzheimer's disease. And I'm told that health is free at the point of need. And I've got a health condition. And then suddenly somebody's saying to me, I've got to sell the house in order to pay for my care. Those sorts of conversations need to be had. And if we had an opportunity to reapportion the money that's available, we might not be in a position where we have to sell our house, or we might be in a position where we could encourage and incentivize people to make provisions for their own long-term care. And partly the reason why that doesn't happen is because no government has given clarity about what people have a right to expect from the system. So insurers won't insure because the risk is open-ended. There was an attempt, obviously, through Dilnot to do some of that, but it gets very interesting how people always frame this conversation in, well, we can't afford it. But there are lots of things that are just paid for that people just think nothing about. Nobody has a conversation about whether or not we should be spending money in X, Y, or Z places, but they always want to have a conversation about why we're spending money in social care.
How are you finding your conversations or interactions with the government at the moment? Are they listening to you?
Well, I think the government is in a strange position in that it has a very big majority and it knows it doesn't need to listen to anybody. I think also it's a government that has developed policy via soundbite, so that, God knows what they were doing in their 14 years in opposition, because it quite clearly wasn't developing a route map to the delivery of their policy. Some of their stuff has come completely out of the blue and from from the left field. So the decision to stop NHS England existing and putting themselves back into the Department of Health and Social Care, nobody had a conversation about that. But interestingly, nobody had the route map around how that was going to be paid for. They seemed to think that it was going to save money, when in fact we all know that structural reorganisations have to be invested in before they start saving money. But nobody seems to have had any understanding of that. We had the decision to, first of all, abandon the reform agenda, but then to bring in the Casey review. And of course, 2028 is her timeline. This pushes it back towards the next election. I'm frankly fed up with this obsession with the question. What we need is a government to find the answer. Now, if any government can do that, this one can, because it has a huge majority. And interestingly, there was a conversation when this government first came to power with the minister, who then talked about trying to find a political consensus. Why would you look for a political consensus when you've got a majority that is so big you can push anything through Parliament? What they needed to do was create a vision and then deliver it. And actually, I said recently, there is a political consensus across all parties in the UK about social care, and the political consensus is do nothing, push it into the long grass, make it somebody else's problem. That's where the political consensus is. And what we really need are visionaries who have got, first of all, an understanding about what they want social care to do. So we want politicians to create the vision in collaboration with people who use services primarily and the sector who delivers them. And then they need to have a route map to get us from where we are to where we want to be. And part of that is about a funding solution. But I see no evidence that this government has got any ideas on any of that.
Do you, notwithstanding the quite extended timelines, do you have any optimism for the Casey Commission?
Well, I think I'm a bit pleased that Baroness Casey has been chosen because she has a reputation for being very, shall we say, independent. And if she believes that she wants to say something, she will say it. But of course, like other reviews, and I can remember back to Lord Sutherland's review, like other reviews, what happens is the government set in train the review, but they don't make any commitment to delivering what the review says. So even if Lady Casey comes up with some really clear, workable solutions, there is no forcing the government to deliver on them. And what we will see is we will see Lady Casey coming up with whatever she comes up with. And I hope that she will be visionary and I hope that she'll be radical. But there will be no commitment to deliver because there will be so close to an election, people will say, let's go to the next election and make it the next government's remit. But I think one of the things Louise Casey needs to do, so she's been tasked with developing a national care service. Well, frankly, a national care service cannot be delivered by 300 and odd local authorities all commissioning in a piecemeal way. We need to have expectations about what citizens have a right to expect. Now, in my view, we could go back to the Care Act as the base of that. The Care Act should be a way of saying we've already started the process. This is what citizens have a right to expect. And then the system, whether it's health or social care, should be then accountable for the delivery of that citizens' rights approach. So if I was Lady Casey, I would focus my attention on a national offer, on the offer and expectations of citizens, and then require the rest of the system to respond to that and to deliver on the basis of also having some clear measures that they are expected to deliver.
Do we have any more details on what the National Care Service might look like? Is it just a brand, or is it the funding comes from somewhere different, or what is it that we know about it?
Well, we don't know anything about it because, again, they've come up with this idea. Interestingly, I think the idea was first floated by Andy Burnham when he was Secretary of Health just on the outgoing of the last Labour government. Now, I assumed that they would have spent 14 years saying, well, Andy Burnham said this is a commitment we're going to make. Let us think about what it might look like. Let us think about what we might need in the system to deliver it. Let us think about how we might develop a route map to get us from where we are to where we want to be. What are the timelines? What are the key performance indicators? What are we going to do to transition? Which is what anybody would do who understands how to deliver change. But none of it seems to be in the remit of government at the moment. Well, they don't have to have a plan.
The cynic would say that setting up an independent review is a pretty low-cost way of kicking the issue into the long grass for a few years and having an answer when people like you challenge them. They go, well, there's a review underway, so you need to see the results of that.
No, exactly. And exactly that's what they've done, Charles. And if you say anything about social care, the default politicians come to is we've got the Casey review. It's all about what Lady Casey's going to say. Well, actually, Lady Casey will say what she needs to say. But underpinning that, I want to know what the people in power have as a vision. I want to know what they're going to do to deliver a better service for citizens. This is what governments are supposed to do. They're supposed to take action that improves things for people. That's what their remit is.
And you elect them to be able to make those decisions and have, as you say, a vision for change is why they're, I guess, elected into office, right?
No, well, exactly. And if you counted how many times they said change was what they wanted during the election campaign, well, change isn't just a change of government, it's a change of direction. And if you're changing direction, you need to know on what road you're going down and what your final destination is supposed to be. And I don't think they've got any of that. They had the soundbite of change, but they didn't have the route map of, first of all, where do we want to get to? And secondly, how are we going to do it?
Do you get many Christmas cards from the NHS or central government?
Well, in fact, I have good relationships by and large with colleagues in the NHS and with, colleagues in government and in opposition parties. But what I'm not going to do is just say what they want to hear, because, I believe my role is to, first of all, track a different approach, but also not just to talk about it, but to say, I have a thought about how we can do it. And, we have got lots of plans, which we gave before the election, which we're giving now. So I've just sent an evidence-based paper into the Casey review, and I've talked about a lot of savings that can be accrued if you transfer money from one place to another in order to deliver outcomes for citizens. So I don't want to be seen as somebody who criticizes. I want to be seen as somebody who criticizes with a route map for how we get to a better place.
You briefly mentioned some challenges with the CQC, and tell us a bit more about what's going on there, because I know that the CQC have always been sort of in your bad books, but they're particularly in your bad books at the moment, are they?
Well, I mean, I was very critical of the CQC, and rightly so, because frankly, it was not fit for purpose. And I do not know how the previous management team at executive and indeed at board level didn't find themselves in serious problems for their failings. So we had the previous chief executive and his senior team who wasted £92 million of our money on an IT system that did not work. And in oversight of that, 92 million. And as far as the chief executive, the outgoing chief executive was concerned, it was a repeating pattern. He'd done it in other jobs where he'd been, which was waste money on IT systems that didn't work. And if anybody wants to reference that, look at Private Eye. But I also have a real problem about the governance of the CQC. So we had all this money being wasted, and we had the people who were on the board of the CQC who failed so miserably in their role in governance and oversight. Now, I am delighted with the appointment of, first of all, Sir Mike Richards as the new chair, and he's brought in a new board. And also, I know Julian very well, the new chief executive, and I have great confidence in his vision for the future. But again, I go back to something I said earlier, which is, frankly, we've got no time to wait for this turnaround. And I've said in the past, and I've said it to both Julian and to Mike, is they should see themselves as a failing, inadequate service. Now, if I was a failing and inadequate service in either the NHS or in social care, there would be an expectation that I would get my act together and improve. And if I didn't improve, I wouldn't be here. Well, they need to identify that as their mission. And I have also called for, and we've just got, I want to see the key performance indicators and the timelines for change, because ultimately that was how the CQC will re-establish credibility with the people it regulates. I want them to create a new vision for social care regulation. Now, in my view, it should not only be about a cornerstone of public protection, but they should also be a sector improvement agency. And if you look to the airline industry regulator, what they do is forensic analysis of incidents. They give clear messages to individual practitioners. In the airline industry, they're often not alive anymore, but if a pilot had made a serious mistake, they identify that. They give messages to the organizations, so they give messages to the airlines, but they give messages to the wider system, so that something happens in the airline industry. If a Lufthansa, the 80 goes down, they don't wait for every airline to find out what the problem was. They tell the entire sector, this is what happened, make sure it doesn't happen in your organization. And that is exactly the approach we need to regulating social care as well.
I think back to my doctoring days, we used to get taught a lot about good practice within the airline industry, about quality improvement and preventing bad things happening. I think the reality on the ground of how the system operates is starkly different to that. Both within the NHS and social care, actually, is very strong. Worse than the NHS, actually, very strong blame culture and inability for organisational learning. What specifically are the problems with the CQC? What is making them inadequate?
Well, they've got serious performance problems. So the IT system that they produced was so dysfunctional that they couldn't even get their own reports out of the system. Now, I think that has been dealt with now since the arrival of both Sir Julian and also Sir Mike. But there is a real operational issue. If you look at the numbers of inspections that they did after COVID, I think their staff just couldn't be bothered to go out anymore. So what happened was the number of inspections went really, really low. Now, what that meant was, if you had a requires improvement and you were sticking with that and nobody was reassessing you, you might have, and some services were in require improvement for 5 and 6 years without a return. Now, that meant that you could not get in some areas local authority commission spaces. And I don't know about you, but if I was looking for a care home for my elderly relative and I saw this one requires improvement, I'd think, oh my God, I'm not putting mummy in there. So that had a really big knock on effect. The other thing it did was a lot of people who had those required improvements, the staff worked really, really hard to get them to good or outstanding, but there was no acknowledgement of that from the statutory regulator. So it then started to undermine staff morale, and it was an impediment to the development of better quality care and support services. So there are also cultural issues within the CQC. So the previous chief executive had a system which was completely, not fit for purpose. And what he did was he brought loads of people in to be inspectors who'd never worked in the areas they were inspecting. Now, both Sir Mike and Sir Julian have said that they're going to bring back specialties. They've appointed new chief inspectors who have the expertise in those areas. But in effect, what we'll be doing is we'll be spending the next 3 or 4 years to get us back to a space where it was when Sir David Bean and Lord Pryor handed it over to this moribund group, a useless set of board members and a useless senior team who were not competent and who quite clearly failed. Interestingly, though, CQC is the guardian of the duty of candour, and they allowed the chief executive and some of the senior team and some of those people who are leaving the board to go with little statements that say, now is the time for us to move on. Yeah, too bloody right it is. You failed miserably, and that should have been a clear and accountable point where people should have been told they were being moved on because of their incompetence and their inability to deliver what we're paying them to deliver. And of course, we need to remember that social care is actually paying for this and paying a lot of money. And so the expectation is, and I have confidence in the new team, but there is an expectation they're going to deliver because we want what we're paying for.
How many people work for the CQC? How many inspectors do you think there are?
I can't remember. They're about 3,000 or something, I think.
3,000.
So that might be completely wrong, but it's a big organisation. It's
quite a big organisation.
Yeah,
it's not. There are many bigger organisations. It's not an insurmountably big organisation to manage, I guess.
No, exactly. And it's like all organisations, if you understand what your role is, you have to get your acts together to make sure you can deliver it. Or in normal circumstances, you'd go out of business. But if you are in the public sector, you're constantly being protected and given time to reconfigure when actually, you should be told to get on with it, because that's what happens in the real world. If you own a corner shop and you lose touch with your customers, what happens is they don't come in, they don't put money on the table, and then you go bankrupt. That doesn't happen to the CQC. All these people have been waiting 5 years for an inspection. I mean, my view is there should be rebates because we haven't had what we've paid for. Also, I want to know why the CQC hasn't had a rebate on the 92 million that it spent on an IT system that didn't work. Well, I think I can tell you why. Because the people who commissioned it were so inept that they didn't do what normal people would do, which is put in clawback clauses. If the system doesn't work, you get the money returned. If I go out today and buy some shoes and they've got a hole in, I go back and I get my money back. But that doesn't seem to be anything that pervades in the psyche of the public sector.
Do you know who built the system for the CQC?
I have no idea, but I would imagine somebody who they thought, first of all, was cheap. Secondly, because they didn't know what they were commissioning. It was quite clear that whoever was commissioning it hadn't got the competence to do it. So nobody understood what they were trying to commission. And somebody told me, and I'm not an expert in these areas, but somebody told me that they had a system that was on an obsolete platform, and that's the start of the problem. But of course, if you don't know that, I mean, I don't know what platforms are obsolete, so it'd be no good me commissioning a system for Care England because I don't have the competence. But they seem to think that they can do it. But of course, if I commission a system in Care England and I don't have the competence and I waste huge amounts of my members' money, the chair would lop my head off and get somebody in who was competent, quite rightly.
Quite rightly. There you go. Okay, so changing track a little bit, Martin. So another sort of key challenge within the sector is around perennial challenges around workforce. Certainly the last 3 or 4 years have had some really significant changes and swings within that. So if you go back to 2021 and 2022, I think we were probably at the lifelong nadir of recruitment and retention challenges within social care. And we were seeing huge huge challenges for providers. Immigration, then some immigration changes came in with the skilled, care worker visas. And actually 23 and 2024, we saw hundreds of thousands of people come into the sector, and that's been, I think, very, very beneficial. And, the challenges that some people have around, things like agency staffing, which is a really good barometer of that, have really, really improved a lot. So I think agency spend across the sector is down about 85% from mid 2022, which is great. What's going to happen now, though?
Well, I think we've got major challenges around both recruitment and retention. And I think some of it is about the fact that since COVID, people's work patterns have changed, and everybody now wants to be in a flexible, working environment. And of course, if you're working in care, you have to be with the people that you support. So our flexibility or lack of it has been a challenge in terms of other sectors have been able to be much more flexible than we have. So that was one challenge. The second challenge, of course, was that we did have overseas recruitment, and by and large, it was really successful. And there were some great people who came in and are making a big contribution to our sector. But of course, what's happened here is that the government has conflated the issue about migration figures with the need to recruit people who we need in our system. And what they've done is the easy thing that governments can do is to close the loophole for people who are actually needed here and who are legal migrants, because they can't seem to get a grip on people arriving on a boat. And what they've done is they've taken the option of saying we're going to reduce legal migration because we can't do anything about illegal migration, which seems completely ridiculous. And if you're going to be in an economy that needs to grow, you're going to have the right skills and the right people. Now, it's very difficult for us to recruit, partly because it's a very complex job that requires people to have the right values. And also because of the funding regimes, it is not a very well paid job, certainly at entry level. So, we've got to think about how we do some of that change to make it more attractive. Now, the government will tell you, oh, we're going to bring in a care wage. Well, that would make it more attractive, but the government won't tell you how it's going to be paid for. And I think the government is of the view that it can be paid for by people who are self-funders, or indeed by organisations absorbing the cost of extra remunerations, and that's just not possible. And the evidence is there that it's not possible. The fragility of the sector has been identified by the regulator. And so what we need is a completely different view about, first of all, how we get this to be an attractive proposition for the homegrown workforce. A lot of that is about training and development opportunities. It's about funding. It's about how we get flexibility into work. And it's about how we make it, I suppose, compete with other sectors of the economy, which are easier and more lucrative.
When you talk about that care wage, okay, two questions on that. First, or points, I guess. First point from me. So, government expecting that increase in wage, which I also am actually very supportive of. Government expecting that to be weathered by self-funders or providers' margins is another challenge. That the social care sector is incredibly diverse, and you have at one end very small independent providers who are really struggling, and at the other end, large national providers with high proportions of self-funders who, you can look at their annual accounts, and as if you work in Whitehall, you can look at their annual accounts and go, well, I'm not sure if these people really need us to be funding any increases in their staff wages. And I guess the problem is it's those people that probably have some of the loudest voices around the table, or at least the most visible in the sector. So I wonder how does that fit in your role, where you have to balance the interests of both, the large national 200 plus site providers and the smaller independents that maybe are struggling a bit more?
Yeah, well, I think one of the things the government need to understand, firstly, is that 60% of this sector are small independent businesses. And they can talk endlessly about the larger providers, and there's great opportunity for people to snipe at them because they make a return, but actually they should make a return. No business is sustainable without money to invest and money to return. And people also, and really annoys me when they snipe at investors in the sector. Well, nobody's going to invest in the sector unless you get a return. I challenge anybody to say, oh, well, I'd love my pension fund to be invested in care, but I don't expect any money back on it. It's just going to be there for, because everybody thinks everybody who's investing in care has a yacht in the Cayman Islands. Well, actually, unless the government can pull out of its pocket about £11 billion for investment, we need people to invest in this sector. And what people need to realize, and I did say it to some investors once who didn't really understand what they're investing in, I said to them, you do understand the level of scrutiny you'll be under if you invest in this sector, and everybody will be sniping at you because you've invested and you're getting a return. I said, if I was an international investor and I had a choice between a widget factory in South Korea and a care service in the UK, I'm not sure which one I'd invest in. So the first thing we've got to do is say, if we need inward investment, we've got to stop sniping at the people who deliver inward investment. The second point about the difference between smaller providers and larger providers, if government policy is to constantly push down the cost of care, it will make the smaller providers completely unviable. And they will, by their policy, make it that the only people who can deliver care are large providers who can do the economies of scale that make it viable. So what government needs to know is that if you snipe, and the media, if you snipe at larger providers and you don't make the sector viable, what you will do is you'll push everybody into being a larger provider, and all these smaller, diverse providers will die on the vine because they can't make ends meet. So what people need to have is a really clear view about what sort of sector they want and then how that's going to be sustained. But I absolutely am happy to defend the people who invest in this care sector, and I'm happy to defend the organizations that get a profit from it, because that's what you have to do to sustain a business. And if you don't like that model, find another one. But if you want to have a model that's all centrally controlled, centrally funded, and centrally delivered, then you better find about 60 billion in your back pocket to do it. And what we have also seen, and the NHS is a good example of this, is that publicly run services are not always in the best interests of the consumer. And we need to focus not on this obsession about structure. We need to start focusing on outcomes and value to citizens.
Interesting. So, Martin, we've talked a lot about what the government needs to do or what other people need to do. If you were a care provider today, what do you think you should be doing?
Well, the first thing I'd be doing is saying, is my model fit for purpose in the 21st century? Do I need to start changing my model? Now, interestingly, I've been quite criticised by some of my own sector by saying I think lazy commissioning by local authorities and the NHS has driven, in a way, lazy provision by some providers who just do what they've always done. And
what do you mean by that? Sorry.
Well, if you look at how the services are commissioned by a local authority, what it does, it commissions people at the high end, and that's all it commissions. So people then only provide services, particularly in residential care, for that high end cohort. But I would be thinking, if I was a care provider, well, how do I downstream some of this? So, for example, there are a lot of people in local communities, usually older people, looking after somebody living with dementia. So could I think about developing some care services or some night support services or some day services or some information services? Now, how I might fund them is I might say, I'm going to get that person who wants to use those services on a direct payment from the local authority. So they've got some money in their back pocket to buy those lower level services from me. Then I can plug a gap that I have in my budget. I could be saying as well, and in fact, some of my members are doing it, I'm going to have a nursery on site. So Nightingale has done it. I know Hallmark has done it. What that does is it brings a different income stream in. But interestingly, I talked to a CEO who's done it, and she said to me, what it's done is reduce my staff turnover, because I've now got lots of staff who know that their children are 100 meters away if something goes wrong. They can bring their children into the nursery and then walk 100 meters to their office or to their shift. So it has so many benefits, and those are
and also just from a sort of, an environment perspective as well, that, mixing, rather than care home being somewhere where people kind of get shut away and ignored, it kind of opens it up to the community, right? Very interesting model.
No, a very interesting model. And you think about also opening things up to the community. So, for example, what could you do with your catering services to make them available for some older people who live in your locality? What could you do to think about getting Costa to open a new coffee shop in your service when you're building it? So there are a multiplicity of things where you can diversify your funding base. Of course, Sometimes the regulator is an impediment to that because they start to jump up and down and say, we don't like this, we don't like that. But actually, if we're going to be fit for purpose in the 21st century, if we're going to be part of communities, we need to also think about how we engage with communities before they need very high level care. And of course, the more you engage with them at low level ways, the more they will trust you when they want high level care.
Great. Martin, last thought. We talked about a lot of the challenges within the sector, and we've painted a relatively bleak picture. What are you optimistic about for the future?
Well, the first thing I'm optimistic about is the innovation and creativity of people in the sector. And I see so much of that. And I know also that we're very good at managing challenge. And we've been doing it for about 40 years. So I think we can continue to do it. I'm also quite confident because if you look at the demographics, there is only one way, which is more need. So we as a sector are going to be necessary. So that's another thing that gives me optimism. I'm also optimistic about the amount of technology that's on the horizon, which is going to improve outcomes for people who use services. And it's also going to improve the efficiency of social care services. I'm particularly interested in digital. I'm interested in how we can use data more effectively. I'm interested in how robotics might transform how people are supported in the future. I'm interested in how we can get a better experience for the people who work in our sector, recognize them. And a lot of that is about recognizing the more we use data, technology, robotics, we'll be a much more attractive destination for younger people to work in. So I think that difficulties and challenges are what we do, and we do them really well. But on the horizon are great opportunities. And I think the optimism I have is that there will be a great number of people who grab those opportunities. Of course, there'll be some who don't, and they'll fall away by the wayside. And on some levels, they deserve to, because the essence of what we do is about being relevant. And we have got, I think, the opportunity to embrace a new era. And I think with the advent of AI, this sector was on the back foot when we had the first technology revolution, care homes who didn't have email for about the first 9 years. Well, we need to be on the front foot for the new revolution. And the new revolution is developing at such a pace. It's not changing, year by year. It's not changing month by month. It's changing week by week and day by day. And we need to get ourselves ahead of that curve. And we need to be recognizing that change will happen. And we can be in one of two places. We can be driving the change, or we can be under its wheels. And I know which space I want to be in. So that's why I'm optimistic.
Professor Green, that's been a fascinating conversation. Very, very grateful for you coming on the pod. See you soon, I'm sure.
Thanks a lot, Charles.